Henry. I'm Chief Sales and Marketing Officer at Waveney Life Care Network. And as many of you know, Waveney has been around for a few years, about 47 years. And strikingly enough, we're still a growing organization. We have integrated the services and the platforms and the expertise very recently, earlier this year, visiting nurse and hospice of Fairfield County. So now Waveney Life Care Network has one of the few full care continuums in Canada. So, from offering not only independent living, but assisted living, memory dementia care, skilled nursing, home care, hospice, outpatient rehab, and everything in between to help not only our seniors, but also our community outreach capabilities through our nursing and through our clinical experts out in the communities. The important thing that we're going to cover tonight is that, there were 3 business units of Waveney that accept Medicare payments, home care, and skilled nursing. But one of the constant refrains we hear from our patients and residents and families.
I turned off the camera. I was on.
Can I just ask for whoever doesn't have their microphone muted to please mute? Thank you so much. One of the ongoing questions we have from patients, from residents, and from our families is, why is Medicare so supportive and so helpful, but so vexing? Everyone seems stymied and confused by the registration process, some of the trade-offs involved, some of the decisions that have to be made. And there are many of our ongoing clients, patients, residents, families, highly intelligent people, but they seem oftentimes flustered when it comes to answering Medicare questions and how to find the appropriate program for them and how to do a proper registration. So the purpose of tonight's session is, as we did last year, to make the registration process and understanding Medicare as a general rule more fun, more understandable, and more easy to navigate. So with that, I'm going to turn it over to Mike Lamagna, who is going to introduce himself and let our other 2 expert speakers introduce themselves. Michael?
Well, good evening, everybody. And my name is Mike Lamagna. I'm a trust and estates and elder lawyer, also a nursing home administrator and professor in long-term care studies. And I want to first thank Waveney Care Center and especially Terry Henry for hosting this tonight. It's very important that people understand not only what Medicare is, but what Medicare is not. And, the differences between the different type of entitlement services. So, the goal is to make Medicare more simple, and but we're not going to make it actually very simple. I'm now going to turn it over just briefly to Natalie and to Gary to introduce themselves.
Thanks, Mike. Hi, I'm Natalie Demace. I work at Barnum. We provide education to individuals when it's time to enroll in Medicare. So I'm a national speaker. I go around the country talking about Medicare, the different parts of it, how to enroll in it. And that's what I'm hoping to share with you tonight. Gary?
Hello, everybody. Thank you very much for joining this important Medicare discussion this evening. I work with Natalie, and I am from New Canaan. So I'm really handling the New Canaan area to help anyone who, after this call, would like to sit down on a one-on-one or through a conversation to help them out here, being a local contact here. Our information will be available after the program. Thank you.
So let's begin. I always like to begin with a lot of the things that I hear. And when I'm meeting with clients, on a daily basis, and we're talking about all the different types of programs that there are, the first is Medicare pays for permanent long-term care services. So people think, look, I turned 65, I get Medicare. All my, my nursing home is going to be covered. My assisted living is going to be covered. My home health care is going to be covered. Medicare was never built in 65 as a program to cure long-term care issues. It's more episodic. So that's the biggest myth that I hear. Medicare and Medicaid eligibility are the same, aren't they? And I get this look, everyone gets the look on the face when I go, absolutely not. Medicare is a federal system. And Medicaid is more of a state-based system, and they pay for different things. And they're very, very different programs, and they have different qualifications. And some people are qualified for both. Some people are only qualified for one or the other. But it is important to actually know what you qualify for. That you're automatically enrolled in Medicare when you turn 65. So the day, you wake up in the morning, you're 65 years old, you jump up out of bed and all of a sudden like a card comes like from the stork in the sky. Well, no, as Natalie will tell you a little later on, it's not an automatic situation. And there are consequences to not enrolling in several of the programs when you should enroll. So it's very important to know not only how to enroll, but when to enroll. People often confuse Medicare with wellness. I can only get on Medicare, right, if I'm well, like almost like a long-term care insurance program or life insurance that you have to be well in order to get it. Well, that is also a myth. And as Natalie will go into at detail regarding advantage plans and supplemental plans, these are very different things and very different programs, and very important programs. And sometimes you have to be very careful when you enroll in either Advantage plan or supplemental plan, because it does have consequences, and it could have consequences as to where you go for rehab, or it could have consequences of what kind of medications that you get, or what kind of services you get. So I urge everyone to pay attention. You're not going to walk away here knowing everything about Medicare, but you probably walk away here knowing a lot more than you did before. So what is Medicare? Medicare is a federal-based system. In 65, they came up with the Medicare system. It's an outgrowth of the Social Security Act of 35. And they came up with Medicare to provide health insurance. So Medicare, when you wake up in the morning, you turn 65 and the stork brings out your Medicare card, all of a sudden money doesn't show up. And that's one of the things people think about. You're like, well, I'm going to get money from Medicare, right? And the answer is no. Medicare is a federal government health insurance program that primarily covers people 65 or older, or younger if you have a qualified disability or kidney failure. It doesn't cover all medical costs. It covers some medical costs, and there are other programs that could cover other medical costs, but it doesn't give you any cash. It only provides health insurance. So that is really important, and you pay for Medicare. So unlike Medicaid, which is a state-based system that you qualify for, Medicare you actually pay into, and it's based on qualifiers, based on how much you work and over what period of time. So you actually pay into the Medicare system. Therefore, you reap the benefits when you turn 65, or if you're disabled, younger. So, as we were discussing earlier when we were talking about, when Natalie and I and Gary were talking about the program, I did think it was really important to talk about Medicare and nursing home rehab stays, because, this is something, as a nursing home administrator, I've been dealing with for many, many years, and there's so many issues around this. Basically, since Medicare doesn't have a permanent long-term care program, Medicare will pay if you have a 3-night qualifying stay in a hospital, non-observation, that your doctor orders for rehab or skilled nursing in a rehab center. Now, the thing is, I'm actually old enough to be part of the whole rehab construct in nursing homes. And for many years, people were saying, no, this isn't a nursing home. This front part, these couple of these 10 rooms that are close to the rehab center, this is a rehab, and the rest of it's a nursing home. It is a rehab, and it is part of a nursing home. Medicare does pay for up to 100 days for rehab or skilled nursing. And that's very confusing to people, because up to means you're not going to probably get 100 days. So people go in and they think, oh, I'm going to get 100 days, so I'm covered for, a little over 3 months. The truth is, at a point in your stay when you no longer need that level of skilled rehab or skilled nursing, if you have a wound, et cetera, Medicare stops paying. They only have to give you 48 hours notice. And what they're going to say is, here's a notification. You have 2 days or more before Medicare will stop paying, and therefore you have to make other plans because you no longer require this level of service. So people get very upset and very confused about this because, a lot of times when you're being discharged from a hospital into rehab, they'll say, well, you get 100 days. Well, the truth is you get up to 100 days. And Medicare Part A will pay for a semi-private room, meals, skilled nursing, physical therapy, and occupational therapy. So, just know you have to ask questions. So this is when you're being discharged or your family member is being discharged from a hospital to a rehab center, you have to ask a lot of questions. You just can't sort of assume that everything's going to be covered. And the limited time frame also has timeframes within it. So the first 20 days, if you're under original Medicare, which you're going to learn about very soon from Natalie, the first 20 days, if you have original Medicare, is covered 100%. From day 21 to day 100, it's $185.50 co-insurance per day unless you have other coverage. And $185.50 doesn't sound like a lot, but if you stayed your full 100 days, that's about almost $15,000 that would come out of your pocket if you don't have other coverage. So once again, people get very upset about that, but it is important to note that. There's also, and this came up twice already this week with the appeals process from the nursing home. And it's not the nursing home's fault, or the rehab center's fault. This is just what Medicare requires. So there are several levels of appeal. The first level, the first two levels are very simple. The third level appeal really is a hearing. I've been through all three. The hearing comes about a year and a half after the Medicare stay, believe it or not. And it's a real hearing and you have a judge, et cetera. Basically, the best thing you can do is discuss, when you get the notice of non-coverage and Medicare is going to be discharged in a rehab center, is discuss it with physical therapy and occupational therapy and explain what's going on at home, et cetera, when they do go home or where they're going to go home next. And, start asking questions upon discharge to the rehab center about how long they project someone's going to stay, et cetera. The more information you get, the more you're going to be able to prepare for that discharge from rehab. The other big deal is Social Security disability versus Medicare. So Social Security, also a government entitlement program, also federal, but Social Security gives you retirement money versus Medicare, which gives you health insurance. So if you become disabled and you're under 65, you may qualify for Social Security disability, and therefore 2 years after you become disabled, according to Social Security, you would get Medicare. So you don't get Medicare right away. You get it 2 years after you start getting Social Security. And Social Security disability is a very high standard. Years ago, it was not. Now, you cannot actually be able to perform any function in the economy, essentially. So Social Security disability, you really have to be disabled in order to get it. Once you do get it, 2 years later or 24 months later, after you are deemed disabled, you would automatically get Medicare. So I'm going to save the Medicare penalty for later, and I want Natalie to begin with describing the 4 parts of Medicare.
Okay. So, what Mike was saying is, the government gives you, all the government gives you is Medicare Part A and Medicare Part B. Am I going to have control of the screen, or could someone forward? So what the government gives you, I didn't realize I was on mute either. What the government gives you is Medicare Part A and Medicare Part B. Everything outside of that is really sold by private insurance companies. A and B alone aren't going to be enough coverage for individuals. So you really need to look at some options, some secondary options. The first option we're going to talk about is having Medicare Part A and B, and then purchasing a secondary supplement or a Medigap policy with a prescription drug plan. Your other option, your option 2, is Medicare Advantage plan. If everyone mutes themselves, you won't hear me echoing so much.
Excuse me, Natalie. Can everyone please mute themselves from your computer screen so that we can just hear Natalie? We're hearing feedback. Thank you so much.
The next slide, Mike. Here we go. Here we go. So with Medicare Part A is really for care in an institutional, specifically a hospital. If you've paid into Medicare and for the minimum period of time, the 40 quarters of the 10 years, there's no premium associated with enrolling in Part A. However, if you never made the 40 quarters, that you could purchase Medicare Part A, and that cost can be upwards of $471 a month. So it's a very expensive benefit. With Medicare Part A, people don't recognize is that the deductible is per benefit period when you go into a hospital. So if I go to the hospital in January and then go again to the hospital in April for an overnight stay, I'm going to be paying that $1,484 deductible each time I go in there. So it's not a calendar year deductible. With Medicare Part B, there is a premium associated with it. The standard Part B premium is $148.50. And Medicare Part B is really designed to cover all costs outside of the hospital. So your doctors, your labs, MRIs, chemotherapy, emergency room, those are all covered under Medicare Part B. This part does have a calendar year deductible. It's not a very large number. This year it's $203. But then after that, it's a 20% copay. So 20% of a doctor's visit, not a lot of money. 20% of a surgery, 20% of an emergency room visit, 20% of chemotherapy, that's where it gets expensive, and that's where the secondary insurance come into play. I mentioned the standard Part B premium. Please recognize that what the government does is when you're enrolling in Medicare, they're going to look at your tax return from 2 years earlier. So for now, 2021, if I was enrolling in Medicare for November 1st, they're going to look at my 2019 tax return. So in 2019, let's say I file my taxes jointly, and my husband and I, our modified adjusted gross income was $200,000. You can see that we're not going to pay that standard Part B premium. We're going to pay instead $207.90 each. And then also we're responsible for paying what they call a Part D income-related monthly adjustment. That's an additional $12.30. So together we'll be paying $220.20. I get a lot of couples say, well, I'm working, my spouse isn't working, they're not making that kind of money. Why should they have to pay that extra premium? Well, you're filing your taxes jointly. They're looking at it jointly. You both are responsible for doing that. The other question I get a lot of time is, yeah, I was making money, but I had a company-owned stock that I had to sell, or I had a lump sum buyout for my company. So my income was a lot higher in 2019 than it typically is. There is a form that you can complete. It's called an income-related monthly adjustment event form, where you can request to say, well, I was making money in 2019, or I sold something in 2019, which made my income go up quite a bit. Can you please reevaluate to try to get your premium, your Part B premium, into a lower bracket? The other thing to note is that each January 1st, the government will automatically look back 2 years and look at your tax return. So come January 1st of 22, they're going to pull everyone's 2020 tax return and determine how much their Part B premium will be for the following year. Next slide. So when to enroll in Medicare Parts A and B? This is the most common question I get. If someone's already collecting Social Security, they will automatically be enrolled in Medicare Part A and Medicare Part B. Whether they ask for it or not, it's going to happen automatically. So let's say my husband is collecting Social Security. He's under 65, and he's covered under health insurance under my employer plan. Well, what will happen is when he turns 65, he will automatically be enrolled. However, because he's covered under my plan, he can ask the government to not have him be enrolled in Medicare Part B, and he doesn't have to pay the premium because he's covered under my employer plan. But he proactively would have to say, please don't enroll me in the Part B. Also, today, with a lot of employer plans, there's high deductible health plans where people are contributing to health savings accounts, or their employers contributing to a health reimbursement account. Recognize that if you are enrolled in Medicare Part A, you cannot be contributing to an HSA or an HRA because there's tax consequences. So again, that's another thing to take note. You can't not have the Part A if you are collecting Social Security. If you're collecting Social Security, you must have Part A, but recognize you should not be contributing to an HSA any longer. If someone's already retired and on just an individual plan and needs health insurance, needs Medicare before turning age 65, well, they need to actively do something. The 3 months prior to their birthday, they're allowed to enroll in Medicare Part A and Medicare Part B, and coverage will start the first of the month they turn 65. If my birthday happens to be the first of the month, then my coverage starts the first of the prior month of the month I turned 65. So if you need health insurance, you need to be proactive and you need to enroll in the Part A and the Part B on your own. Well, many people, again, are working longer. They're not retiring at 65. They're retiring at 66, 67, 68. But recognize that when you do decide to leave employment, you must apply. Your employer would have to fill out paperwork that says Natalie has been employed and has credible health insurance with us from age 65 to present. And that'll allow me to apply for Medicare Part B without any penalty, because you do not want a penalty with that. I get a lot of questions where people are getting packages from work. Well, I'm over 65. I'm getting a package where they're going to pay for my health insurance for 12 months. Well, that's great. However, recognize even though you're covered under an employer plan, you still must apply for Medicare Part B within 8 months of leaving employment or losing coverage, whichever is earlier. So though my previous company might be paying for my health insurance, I must enroll and start paying for my own Part B coverage starting 8 months after my last day of work. Next slide. So we talked about A and B. One of the secondary options you talked about is a Medigap plan or a Medicare supplement plan. These plans are designed to cover some to all of your out-of-pocket expenses. They are sold by private insurance companies. The government does not sell them, but the government does dictate what must be covered at a minimum under these plans. This plan allows you to see any Medicare provider anywhere in the United States for a Medicare service. You must be enrolled and paying for Medicare Part A and Medicare Part B, and a drug plan, a Part D plan, would be sold separately. You also cannot have a Medicare Advantage plan and also a Medicare supplement plan. They won't allow you to have both of these. Next slide. So when you look at, we call it the alphabet soup of Medicare. We have Medicare Parts A, B, C, and T from the government. Well, then the supplements go from the letter A to the letter N. Again, the Center for Medicare Services, CMS, regulates what must be included in a Plan G. So all the Plan Gs at a minimum have the same medical coverage. What's covered under Plan N, same thing. However, the differences between the companies could be their premium. There could be quite a big difference in premium from one company to another, and also some of the value-added discounts or services that that company might provide.
Hey, Natalie, this is Terry. Can I just interrupt you for a second?
Yeah.
Yeah. What determines what letter is designated to what part in Medicaid? And is there any significance to a letter? I know it's a silly question, but that may be on people's minds.
Oh, Terry, thanks for setting me up. My next two slides are going to answer that question. Perfect timing.
Okay.
So if we look at the next slide, those are the letters A through N. This chart is busy. We're not going to talk through the whole chart, but if you look at the next chart, the next page, here we go. These are the more popular plans. So this is what we're going to talk about. A lot of people ask me about the Plan F because the Plan F is the most comprehensive. So a lot of our parents were on the Plan F. Well, if you turned 65 prior to January, you needed to turn 65 prior to January 1st of 2020 to enroll in a Plan F. Anyone new aging into Medicare is not eligible for it. Well, the next most comprehensive plan is the Plan G. With the Plan G, all your again, if you're having a Medicare service by a Medicare provider, all of your expenses, your Part A, Part B deductibles and coinsurance are covered, except for, see that little grayed out area, the Part B deductible. So I mentioned earlier, the Part B deductible this year is $203. That's the only medical out of pocket you would pay if you're enrolled in the Plan G. Some people don't need that much insurance and may be trying to save a few dollars. The Plan N would be the next plan that people would look at. So if you look at this Plan N, What's not covered under the plan N is the calendar year deductible, the $203. And also you'd be responsible for a $20 copay to go to the doctor and $50 for the emergency room. In states, Connecticut and New York are not one of them, a provider may charge an excess fee, so they could charge you an extra 15% on top of the Medicare approved chart. So I mentioned a lot of employer groups are doing high deductible plans. Well, Medicare is the same way. There is a high deductible G plan where the premium's a lot lower, but what happens is Medicare A and B are primary, but you are paying all deductibles and all coinsurance up to $2,370 per year. So it allows you to have a low-cost plan because you're not going to the doctor very often, but it's hedging your out-of-pocket expenses by capping what your exposure is. So it's definitely something for someone to consider if they want a Medicare supplement plan, but don't go to the doctor typically very often. Next slide.
Hold on a second. Why isn't it? Hold on. Oh, there we go.
There you go. So with a supplement plan, you must purchase a separate Medicare prescription drug plan or a Part D plan. These plans are designed to lower your prescription drug cost. They are sold by private insurance companies, but it does not have to be the same insurance company that you purchase your supplement plan from. You must live in the plan service area. So if I'm in Connecticut and then later on I move to New Jersey, I need to purchase another plan. So again, it's based on the plan service area. These plans vary greatly by pharmacies. You know, some people like to go to their grocery store for their pharmacy. Some people love CVS. Other people love Walgreens. Well, it makes a difference from one plan to the other. What they have is their preferred pharmacies. Drug coverages are also included under Medicare Advantage plans that we'll talk about in a few slides. And the one thing, and Mike mentioned it in the beginning of our presentation, if you don't purchase a Part D plan when you're first eligible, there could be a penalty that you'd be responsible for. So it's really important to understand when you need to do certain things and to do it so that to make sure you don't have any penalties. Next slide. With Medicare drug plans, whether it's a standalone Part D plan or part of a Medicare Advantage plan, each plan has its own drug formulary. And then within the formulary, they assign tiers. So a tier 1 would be a preferred generic. It would be a very low copayment. A tier 2 would be a non-preferred generic. Tier 3 would be a preferred brand, and so on. So again, the lower the tier, the less expensive the drug. It is important to take a look at your prescriptions every year because a plan might have a tier 3 this year on my plan, but next year there might be a plan that has it as a tier 2, which could save me quite a bit of money. Next slide. With prescription drug plans, there's something called a donut hole or a coverage gap. I'm sure people have heard about it. What happens is there's different stages of the prescription drug coverage. You have the deductible during the initial stage, but when the retail price of your prescriptions totals over $4,000, what happens is there's a gap in your coverage. And during that gap, you're paying 25% of the cost, whether it's a generic or a brand name drug. You'll be paying 25% of the cost of that drug. You stay within that gap until you're out of pocket. It's a calculation, a complicated calculation the government does, what they call their true out of pocket. That number ever totals over $7,000. Then you go into catastrophic coverage. And with catastrophic, what happens is you're responsible for paying 5% of the cost of the drug. I have some clients I've worked with who never even, go outside of the deductible stage. I have some people that are in and out of the donut hole and in catastrophic in their first month. So it really makes a difference on what the retail price of their prescriptions are and how it impacts them from year to year. Next slide.
Real quick, Natalie, can you share how people can actually find out, which the best Part D program, the formularies?
Sure. So we're really lucky. The government came up with an amazing program on their website. It's called Medicare.gov, where you can actually go in and you click the button. It says, look at 2022 plans. You put in your home zip code, and then you can put in all of your prescription drugs. If you have an account already set up on Medicare.gov, it'll already know which drugs you filled in the last 12 months that you can look at, that you can add in there. When you pick your pharmacy, it'll tell you at the end what your overall expected cost will be for the next year based on the premium, the deductible, the tiers, the cost, the coinsurance. So it's a really great tool. You should fool around with it if you haven't fooled around with it. It's a great tool to go in there and take a look at, what is your lowest cost option? And remember, you don't want to just look at premium. A lot of people think the premium is going to dictate which plan is better. A high premium doesn't mean it's a better plan for you. So it's really important to look at it overall. Thanks, Mike. That was a great recommendation. So when we talked about the supplements, we talked about the drug plans. The other thing to talk about is Medicare Advantage plans or these Part C plans. Most of these plans are HMO plans, which means that you must see providers that are in that plan's network. So a lot of times people say, well, I currently have Aetna at work, so I'm going to go on an Aetna Medicare Advantage plan because my doctor's in the network. We'll recognize there's different networks of doctors. So it's really important to take a look to make sure your doctor's in the network if you want to enroll in one of these types of plans. Some of these plans allow you to go see doctors outside of the network. You'll save money by seeing in-network doctors, but on a PPO plan, it allows you to go outside of the network. You're just going to have higher copays and higher cost on that. Also within Medicare Advantage plans, there's different type of special needs plans. Some of these plans are based on low income subsidy. So if your income is below a certain level, you may qualify. Mike mentioned the Medicaid, Medicare. There's some people who qualify for both. They call them duals. You might qualify for one of those plans. Or if you are in a facility, there's institutional special needs plans that you can enroll in also. When you look at Medicare Advantage plan, here's just a quick sample of 6 random plans. Again, you must have Medicare Part A and B, but it goes away and it's in the background. It's replaced with this Part C plan. So you can see on there, there's 6 plans. All of them are 0 premium. So while you're paying your Part B premium, there's no additional premium due for this plan. Then what happens is you have copays every time you have a service up to a maximum per calendar year. And you can see over there on plan 1, the maximum out of pocket is $6,700. So if I go to the doctor once or twice, this plan really didn't cost me anything. But if I'm in and out of the hospital having services, it could cost me out of pocket $6,700. Really, with these plans, they've been offering, and every year they seem to get better and better and offering more and more. And it's funny when I talk to people on the phone, I could hear in the background, I could hear the commercial on Medicare. So they're advertising for it all over the place. But a lot of these plans have extra things. So a lot of things that Medicare does not cover, these Medicare Advantage plans will include. So if you look on the bottom of the screen, there's the hearing, the vision, a gym membership, dental and over-the-counter benefit. So they're adding in a lot of extra things to entice people to enroll in these types of programs. We are lucky that in Connecticut, we're able to enroll in one of these plans. And then every year during open enrollment, we're able to switch plans and enroll in a supplement plan if we'd like. So it's nice that we can test this out for a few years, make sure it works for us. And if it doesn't, we can still switch over without regards to our any diagnoses or medical background that we have. Next one. So we're looking at supplements versus an advantage plans. You know, when we look at cost, remember a supplement plan, you're going to pay a premium. However, by paying a premium, there's going to be a lot lower to no out of pocket. For an advantage plan, no premium, higher out of pocket. I laugh and I say to people, you pay me now or pay me later. So it matters, how comfortable you are with one way or the other. As far as providers, it's easier with a supplement because you ask the doctor, do you accept Medicare? If they say yes, then they're covered. With an advantage plan, you have to say, do you accept Medicare and do you accept my Medicare Advantage plan? So it's really important to take a look at that. And while some plans will allow you to go out of network, it could cost you a lot more money. Now, looking at the coverage with a supplement plan, it only covers the medical. Then you need a separate prescription drug plan. Or an advantage plan, it includes the prescription drug plans and also offers some extra things like an annual preventative physical and the vision, dental, and hearing benefits. So they offer some extra things. So what to consider when it's time for you to select a plan is really or to reevaluate your own plan that you're enrolled in is the benefit. You want to know what's covered and what's not covered. Mike mentioned earlier the long-term care. So many people think, well, I have Medicare, I have long-term care. Well, no, Medicare is only skilled care. It's not that personal custodial care under long-term care. Are my doctors in my hospitals, are they covered? Do I need a referral to see a specialist? These are things to know before you purchase the plan. And when looking at the cost, you want to look at not just the premium, but you also want to look at what is my coinsurance, my co-payments, my deductibles. How much will I be responsible out of my own pocket for a lot of these services? Take all of that into consideration. Prescription drugs, I spend a lot of time. I feel like a doctor sometimes because I'm working with these drugs all the time. Every year, everyone should be evaluating their prescription drugs and how they're handled on their plan. You could go on to Medicare.gov and take a look at that. You could look at the formulary on your annual notice of change letter, but take a look at the prescriptions and take a look at it every year. It's so important. What's also important to consider is, are you traveling? Are you out of the state part of the year? Do you travel outside of the United States part of the year? How would my plan work? So there are different plans, have different rules for that. So you want to better understand that so that you can enroll in a plan that works for you. Newer the last couple of years are the star ratings, and they just announced all the star ratings. I think it was this week that they announced it. What these are is it's a rating system where based on member surveys by provider scores, it's an overall performance score, not just for the carrier, but each product within the carrier. They go from a rating of a 1 to 5, 5 being the highest, and really designed to help you compare the quality and the performance of the plan. Again, you look at a price, you say, is that good? Well, who knows? You got to really take a look at it. So it's designed to show the quality and the performance of the plans. And then these ratings change every year. So if a carrier has a bad score next year or a bad experience with their members, the next year they'll probably get a worse score. They'll have a lower score. So that's one way of looking at them.
I'm sorry. And one thing I'm just going to chime in here real quick, Natalie, is to think about what would happen if you don't have coverage. And, and that's why I gave a good example in the beginning if you don't have coverage that covers that coinsurance and you stayed in a rehab center for 100 days, it would cost you out of pocket $15,000. So guaranteed the premium, to cover that coinsurance wouldn't be close to the $15,000 that you would have to spend. So there's a cost to not have these programs as well.
Yeah, you're right. You're absolutely right. Again, I mentioned earlier, but you could look at these plans every year. So every year there's something called an annual enrollment period. That period goes from October 15th through December 7th and allows you an opportunity to really reevaluate the plan you're enrolled in. Make sure you're happy with your decision. You're happy with the changes that are coming for the next calendar year. You want to look at your prescription drugs, and you want to make sure that is the right plan for you. Again, in Connecticut, we're lucky. You can switch from a Medicare Advantage plan to a Medicare supplement plan. In other states, so it's important if you're planning on eventually moving to another state, it's important to take a look at what the rules are in that state. Because if I'm in Connecticut on their Medicare Advantage plan, and then I move to Florida, when I if I want to enroll in a supplement plan, they will ask me medical questions. And depending on the state, they could either charge me a higher premium, or they could say, sorry, Natalie, we're not going to take you. You're automatically declined. So it's important to know the rules on where you're going to be so that you can make decisions appropriately for that. After that enrollment period, there's actually another enrollment period. It's called a Medicare open enrollment period. That period is for the first 3 months of the year. And it's really for people who enroll in their Medicare Advantage plan or just have their Medicare Advantage plan re-enrolled. They go into it and then they find out their drug isn't covered or a doctor is no longer in that network. It allows them a one-time opportunity to switch out of that plan and switch either into another Medicare Advantage plan or to revert back to Medicare Part A and Part B and enroll in a supplement and a drug plan. And then if I move, I mentioned moving a couple of times, if I move to another service area, I am required to change my plan because these plans are all based on service area. So I'd have to enroll in a plan. They might have a similar plan, similar company, similar premium, but I'd have to switch over to that plan. And then if there was a 5-star plan in Connecticut, and I don't think we have any this year, then I would be able to switch into that plan at any time.
Hey, Natalie.
Yeah.
For folks who are just looking at this, it seems to me that trying to assess quality and value, that those 5-star ratings are a game changer, yes? And so if they're that important, is that the best determinant folks should be using as a starting point?
That's what the government's expecting. It's new still. It's only been a few years old, it may be 3 years old. I've been watching the scores, and sometimes I don't know. From my professional experience, I wouldn't rely strictly on the star ratings, because there's a lot of good companies out there who maybe 1 year you get enough people with loud mouths complaining, they're going to get a bad score, where they're really good companies and real reputable products. So today, I would say not 100%, but I'm hoping in a few years, yes, that'll be a great indicator to say, hey, stay away from this company because of their reputation, and you might want to look at a different company.
And I also, Terry, one thing that I rely on is people like Gary that have the expertise in the different programs to guide my clients on how to, on not only what are the differences between these things, but what are the experiences of his clients, with a particular plan. And I think that that's an important part, because, it's like the same thing with the star ratings for the rehab centers, of which Waveney always gets fantastic star ratings, which there, I believe, but there's some other facilities that underreport things, et cetera. And it's like that with anything. But once again, you have a couple of family members that have great experiences at a place like Waveney, and that also makes a difference. So I think relying on the experts, I think makes a big difference as well.
Great. And for folks who joined the call late, Gary Antonello is on tonight's Zoom call. He is reachable. His contact information is there. Would now be a good time, folks, to open it up for Q&A? What do you think?
Sure.
Yeah, that'd be great.
Awesome. So anyone on the call at this point in time that has follow-up clarifying questions, or now's the time, please share your questions.
Hey, Terry, I don't know if you can hear me. It's Fred Bromberg.
Hi, Fred. How are you, my friend?
All right. It's been a long time.
Yeah.
You never know where people show up.
I know. It's great to see you.
Yeah, good to see you too. One question which was mentioned, which is this: if you spend part of your time in Connecticut and part of your time in another state, what is your coverage then when you're in that state, whether it be Massachusetts or Florida or any place else? Are you automatically covered, or do you have to make sure that you have a special program that allows that?
Hi, Fred, it's Natalie. So with that question, again, it matters which plan you're on. So some of the Medicare Advantage plans have national networks. So I recommend, if my client is on one of those plans, I'll say, before you leave to go see your child in Chicago, you want to look to see what urgent care centers are nearby. So at least you know what's in network and what's not in network. But let's say I was going cross country and on the way, something happened. I break a leg. I cut my arm. All the plans have emergency services. So you could go to the emergency room, not to a specific doctor, but to the emergency room, and you'd be covered. I mentioned with the supplement plans, it's a little easier, again, because you can see anybody that accepts Medicare. So you'll find more doctors, more providers that accept Medicare than might accept a specific Medicare Advantage plan.
Okay. And just as a follow-up to that, sorry, and then I'll let everybody. There are some doctors who don't accept Medicare. Why is that?
Some doctors are concierge doctors, Fred. This is Mike Lamagna, and so that they've opted out of taking Medicare and or Medicaid, and they just see private clients, and the reason is reimbursement. The reimbursement from Medicare, is not great versus private pay. So it has to do with, a financial decision.
Okay.
Hi, this is David Reed. I'm a board member, and my job is dealing with Medicare and Medicare Advantage plans every day. So I just have two comments to share. One, is the warnings about the STAR system, particularly when they're new, is well warranted, because it's like everything. It depends on what you're measuring and how they get that measurement. For nursing homes, and I know with Waveney does very well, but it is quite variable. We've tried to use that to help people select a facility. So I would say that that's something to factor in. The other thing is, Milton Friedman famously said years ago, there's no such thing as a free lunch. And if you watch daytime television at any time, there's 50,000 Medicare Advantage ads. And they tell you, you get $100 a month, you get free dentistry, you get free hearing, you get all these things. Well, nothing's free. First of all, they're very limited benefits, but more importantly, you don't control your destiny. If you have A and B, you can go anywhere to anybody. You get a brain tumor and there's one guy at the Mayo Clinic who knows how to do it, you can go there. With managed care plans, you simply cannot for most of them. Also, when you're in the hospital, they push people out quickly. They limit nursing home stays. They do all kinds of ways. So they're happy to give you, $500 a year in dentistry or whatever it is, but they take it out elsewhere and they make huge profits. There's just been a number of them that are under investigation by the federal government by evaluating patients and making them seem sicker than they were. So they collect a higher premium, and they're going to have to pay back hundreds of millions of dollars. So I would just let you think about that there's no free lunch, because there truly isn't.
Mr. Reed, this is Mike Lamagna, and I think you bring up a very good point that I speak with my clients a lot about. And I think specifically, just so everyone understands, Mr. Reed is talking about the Medicare Advantage plans. And, like any type of HMO, et cetera, or PPO, you have, you trade off cost of a premium for access. And so what happens is with a lot of my clients, they have an Advantage plan, they're going to a rehab center, and they think, okay, I can go to any rehab center that I want. And the truth is, you can only go to a rehab center that has a contract with that Medicare Advantage program. And then they control your destiny as far as how long you get to stay there.
Exactly.
So it's not the standard original Medicare that we talked about, where you get up to 100 days. Like any managed care program, what they do is they check the notes every few days. And when they decide that you no longer require that level of care, then they decide that you have to leave. So you don't control your destiny, as you said. And it's a very important point, which is why I wanted to overemphasize it. You are trading off some goodies for access. And at the time that you really need the access and you need the rehab center, and you want to go to X place, you may not be able to go.
Yeah, it's Dr. Reed again. I would just say that some people, it makes a lot of sense. They don't travel much. They're local. Excuse me. They have limited financial resources. It can make sense. But you just have to, as Mike says, you just have to look at the big picture, and what you're willing to accept. Because if you look at it on TV, it's the best deal you ever saw, and snap it up before it goes away.
Thank you very much, Dr. Reed.
Sure.
Hi, this is Sandra Leverich. Can I ask a question?
Go ahead, Sandra.
I already have my Medicare card. I turned 65 last December, but I am still working, and I plan to work to that 66 in 2 months, which is February 14th. I'm just getting very nervous of the timeline when I have to do things. I mean, I get like 20 pieces of mail a week, like this plan, that plan. I don't know the timeline that I need to do things. Do I need to have that all in place when I retire, say March 1st?
Yes. So let me take that for you. So if you need coverage to start March 1st, you're getting solicited because everyone and their brother knows you're turning 65 and they want you to enroll in their plan. So,
right.
Don't feel so special. Everyone's getting it, but it's overwhelming. But yes. So in January, if you need coverage to start for March 1st, in January, There's a form that your employer will need to complete, and then you can upload that form onto a Social Security website to allow you to enroll in Part B and make sure that there's no penalty. And on there, you would request that you want your coverage to start March 1st. So it gives you plenty of time to do it. Can't do it too early because they'll actually say, come back in another month or two. So you want to do it about 2 months before you want your coverage to start. And if you need help with the website or the forms, Gary can help you with that.
Okay. Yeah, it is a bit overwhelming, you know?
Mhm.
So, yeah. So, I have medical coverage till I retire. I haven't really picked the date, but I'm hoping as soon as after February 14th that I can, I will. So I have to get a form from my employer, you said?
It's a government form. So again, if you ask Gary, he can send it to you. It's a government form that your employer must complete, and I can give you the website for you to upload it on there.
Okay. Okay, so I'll speak to Gary about that and get all that separately. Okay, perfect.
Okay. Just recognize when people don't know to ask the question sometimes is if you're looking to stop working on February 15th, some employers will provide you with health insurance till the end of the month, while others say, okay, the day you leave is the day your coverage stops. So know the answer to that question so you know if you want your Medicare Part B to start February 1st or March 1st.
Yeah, I'm trying to figure out if it's best to do it at the beginning of a month, the middle of a month, or I'm always thinking the beginning of a month is probably the best time than in the middle. So, but I will figure all that out.
Okay.
How do you sort through those mailings that you get? You call them and find out prices and all that?
Well, you could, or you could work with someone like Gary who represents all the companies in Connecticut, and he can help you identify again, typically what you'll look at first is your prescriptions, then your doctors, understand what your needs are and help you make a decision. Is a supplement plan the right plan for you? Is an advantage plan the right plan for you? And really make sure you understand the good, the bad, and the ugly having to do with all of them.
And Natalie, it might be a good time to explain, how, what are Gary's fees for doing all this and all this assistance?
Yeah, thanks, Mike. So with doing this Medicare planning, there's no additional charge to you. So whether you use Gary or call 1-800, whatever insurance company, your cost is going to be exactly the same. Gary will be paid a commission from the insurance company if he submits an application to them. So you could use Gary free of charge. He'll do all the fact finding with you. He'll do the implementation. He'll do the quoting for you, and he'll actually do the applications. And then afterwards, he'll help with the servicing. So if you have issues, you can call him and say, hey, Gary, this doesn't sound right. How does this work? So you're getting all of that really at no additional cost to you, and the insurance company will pay Gary a commission.
So there's no out of pocket for us to do that.
Correct. Right. It doesn't cost you anything to use us.
Okay. My question is, Gary's in Connecticut and I'm in New York. Is that
no problem?
Still feasible? Okay.
Yes.
Perfect. Because I'm going to need help.
Okay.
At some point.
All right.
Can I ask a quick question? It's a quick one. It's following from the prior questions. Thank you for the informative presentation. One, would you be able to forward these slides to us, to the participants by email, so we can have this as a reference resource? There's a good information there. It's hard to absorb all at once. Would you mind emailing it to us? And secondly, if you, in addition to being out of state, if you're also going to be overseas, let's say in Europe for part of the year, what should we be looking for then with a carrier? Like what specifically can you do to try to find out what is the best coverage when you plan to spend several months, years, and say in Europe? Those are my two questions. Thank you.
So Terry, will you be able to send the presentation out to everybody?
Yeah. To make things easier, folks, whoever would like a copy of the presentation, could you please email me? This is Terry Henry. I'm going to give you my email address. It's T Henry, so T is in Thomas, HENRY, at waveney.org. T Henry at waveney.org. Simply send me an email with a request for a copy of the presentation, and I would be happy to send that out to you.
Thank you.
You're very welcome.
So, Christian, your question regarding the international gets a little complicated. Sometimes it depends on what country you'll be visiting. Sometimes if you're dual citizens, you'll have some coverage in that country. So it's very particular to the individual. Both plans have some, not a lot, but some international coverage. The other thing is you might want to look at an international travel medical plan that's available.
Yeah, it gets very complicated very quickly because also the cost of medical assistance are very different. If you go to New Zealand, for example, have a New Zealand passport, it's pretty much for free there, but there's no guarantee I will spend time there. But the other countries, the Netherlands, where it's far from free and it gets expensive quickly. So it's complicated.
Yeah, if you want to talk through that, we're more than happy to talk through it with you to show you some of the options. But it does get complicated. It does get complicated for which countries. And again, are you a citizen of that country? Or are you just traveling through? And are you there for a week or are you there for 6 months? It makes a difference also.
Yeah, got it. Thank you.
Any other questions for our panel?
Yes, I have a question. If you're in a long-term care facility rehab and the insurance company decides that you're going to get kicked out, is there any payment that you can get going forward, or it's all on yourself?
What do you mean? What do you mean? Financial assistance?
Yes, financial assistance.
Well, I mean, one avenue, depending on what your income and assets are, would be Medicaid or Title 19 to cover the stay. The other option is to go through the appeals process, which there's 3 levels of appeals. You could certainly avail yourself of that.
Okay, great. Thank you.
Any other questions going around the horn? Any other questions? Wow, I think you guys did an awesome job of either anticipating or answering questions. One more time, any other questions?
Judy, I think there's someone named Judy that's raising her hand, but she's on mute.
Right. Sorry, I forgot. There's so much to absorb. I don't know whether we're really so good in absorbing all of it or we're sort of a little, speaking of being mute, we're a little mute trying to take it all in. But thank you very much. This is a very organized presentation and I appreciate it.
Thank you for participating, Judy. We appreciate it.
Thank you.
And I will also say that I will also my information isn't on the slide, but I will forward it to Terry. I also do a free consultation, whether it's Medicare or estate planning or elder law, et cetera. So if anybody has any issues regarding that area, also happy to do a consultation. And for anybody on this Zoom, if you reference it, there would be no cost.
Thank you.
Terrific. Thank you, Mike. So it looks like we may have exhausted the questions, at least for the moment. I'll just ask one more time. If there are any other questions, feel free to ask. Don't be shy. Now's the time.
Yes, I have one more question I thought I'd throw in here. Can I ask a Medicaid question?
You know what? If you email Terry, we can do that offline.
Okay, great. Thank you.
You're very welcome. Well, if there are no other questions, I want to warm-heartedly thank all the participants, our wonderful panel, and you folks in our community and on our board for participating. We appreciate it. This has been really informative for everyone. If there are any follow-up questions after this, feel free to contact me, thenry@waveney.org, or Gary. His contact information is still up on the screen, and I can help put you in touch with the right person.
Thank you.
Thank you so much, folks. Have a great weekend.
Thank you. Thank you, everybody. Nice.
Thank
Bye.
you.
Thank you.
Thank you very
Bye.
much.
Thank you.
Have a great night.